Welcome to the Mental Health Book Club podcast with your hosts, Sydney Timmins and the Secret Psychiatrist. We would like to take this opportunity to let you know that we will be covering a diverse range of mental health topics that may be distressing to some listeners. You can find a full list of the topics being covered in our show notes. Please check the show notes before listening to any of our episodes. Welcome to the Mental Health Book Club podcast with Sydney Timmins and the Secret Psychiatrist.
Hello everybody, I'm the Secret Psychiatrist. Happy to be back.
Yay! So, if you haven't heard about the Secret Psychiatrist before, she is the fountain of all knowledge because I go, I need to find this out. I know, I'll ask the Secret Psych. So, I
paid her to say this.
Yeah, the check is in the post. So if you haven't heard about her before and what she gets up to, I thought we would get her to give us a bit of an introduction about the things that she's up to. So go for it.
Perfect. So I'm a psychiatrist. I'm working in the NHS in London and I travel a lot volunteering with mental health. So I see lots of different cases abroad that I sometimes plot in the different podcasts. And I wear a different hat. So really, I don't know why I'm saying this one, but I want to laugh, but I'm also an actress and a writer. I know. I don't know why I laugh every time I say that, because every time I tell people that, they're just like, what? But anyway.
I think that's cool.
I think it's cool
How
too.
How cool is that?
But their face is always like, what are you on about? And I also write for the Happiful Magazine as well.
Brilliant. Well.
Oh, and I also have a website. I don't know why I always forget this. The www.secretpsychiatrist.com, and you can find me on Instagram, Twitter and Facebook.
Yeah, never forget those, because those are important. So if people want to get in contact with you, we know how to do it. Yeah, always important.
I know. It's like lots of doors to contact me.
We will find out who you are. You will no longer be secret. No.
The secret will be out.
So today I was hoping that we could talk a little bit about attachment. And I know it's a huge subject. And it's one that's probably quite close to my own heart, because I do think that I probably have issues with attachment. And so I was wondering, what is it about attachment that is so important to people?
So, yeah, attachment is a really diverse, it's such a huge topic, actually. And when you're doing a degree as well, it's a huge module, especially for psychologists. And if you're doing CAMS, which is child and adolescent mental health, it's something you really have to understand. And it's such a huge topic that I've split it. So I'm going to give sort of the core crux today, and maybe later on I can add in a few bits and bobs, because Freud, obviously I have to talk about Freud at some point in the podcast. And
been waiting.
He kind of talks about, we're just waiting for that big bad boy podcast to come out. No, so I'll definitely talk about it, the crux now. So this is something that psychiatrists and psychologists have studied, and we normally talk about it when we're referring to children. So the definition, what is attachment? We talk about it, again, talking to children, their child and their caregiver. It develops through appropriate parental responses to child's behaviour. Having an appropriate attachment allows a basic stepping stone for having a safe separation of the child from the parental figure, as well as their own development regarding their autonomy. So if you think about it, if you have a secure attachment with your parent figure, I mean, it doesn't have to be your biological parent, but your carer in a way, then you'll have sort of a secure separation growing up and also developing in yourself as an individual. So Freud would have thought that it was the mother's fault if something went wrong with the attachment, but there are many other important factors, obviously, as we know, that can influence that. And in another podcast, I am going to be talking about Freud, and I'm excited to share that one, but at the moment we'll stick with attachment. So what's the psychology theory of attachment? So this is developed by John Bowlby. So he was an analyst.
I don't think I've come across the word analyst in psychology or psychiatry. Would you be able to tell us a bit more about what that is?
An analyst meaning somebody that you go in a way for intense psychoanalytical therapy. So you go and essentially they analyse you and you talk about your childhood. So that's what an analyst is. And they kind of talk about what's happening in the present moment and how the relationships might be affected by that from past history in a way. And so he talked about and researched the effects of separation of infants from their parents. And he thought that extreme behaviours of infants engaged, and that was due to evolutionary mechanisms. So behaviours through natural selection were reinforced, enhanced through their chance of survival. So sort of instinctual reactions, basically, and that's what he thought. So here, the research showed that when an infant was placed in an unfamiliar situation and they were separated from their caregiver, they would show 3 different reactions. And later that was sort of built on over time. So there are 3 different sort of reactions, and another 4th came in later on. So you have 1, you might react in the secure attachment way. So about 60% of children react in this way. So they use their carer as a secure base to explore freely and go back to them for comfort. So here the carer is sensitive towards the child's needs. A second reaction that a child might show is an insecure, avoidant, anxious reaction. So about 15% of infants show that. And that is when you have minimal distress in the infant or being separated from the carer, but sometimes ignores and avoids them as well. And that could be because they might be avoided by their own carer, and that's why they react in that way, their caregiver. The third reaction you might find is insecure, ambivalent, resistant one. That's about 10%. And here you get high levels of distress in the infant upon separation, and it takes quite a long time to settle the infant down. And they resist comforting, and that's thought to be related to inconsistent sort of caregiving from their caregiver to the infant, and that's why they react that way. Then the 4th one that was added on later on is a disorganized, disorientated reaction, which is about 15%. And that sort of contradictory behavior you see in the pattern of the infant. So, and that's thought to be due to having a caregiver that's frightening or frightens the infant themselves, and that's why they react in that way. So through Bowlby's work and his sort of research, he had a strong belief the impact of family experiences on children really impacts their emotional and behavioural well-being. So obviously his work really helped establish sort of the reactions of children and infants and how later on it can affect them. Another important, really big name to mention is a psychologist called Mary Ainsworth. All psychologists will know about her because they'll have studied about her. So she proposed that children need to develop a secure dependence on their parents before entering sort of unfamiliar situations. And she developed the strange situation procedure in 1978. I thought I'd mention this because it's really important in history to mention about this situation. So what happened here? She looked at infants between 12 to 18 months and she put them in a different phase, and each phase lasted about 3 minutes. So sort of the different steps that happened for her to come to her conclusions was a caregiver enters the room with their child, say their infant, then they have a stranger enter the room. So at the same time, so 3 of them are then in the room. Then the infant's caregiver leaves, then the caregiver returns, then the next step is the stranger leaves, then the parent or caregiver leaves again, and the stranger returns, and then the parent returns and the stranger leaves. So it's quite repetitive steps. But if you think about those different steps, if the caregiver's leaving, the infant's being left with a stranger. And so that reaction is looked at. And then when the stranger leaves, the reaction with the child, with their caregiver is looked at as well. So here, it was found that in secure attachment, the child finds discomfort when their caregiver leaves and is sort of comfortable with the stranger when the caregiver is present in the same room with the infant. Then it was found that those that have that avoidant insecure reaction, here they found that the infants were unconcerned when the caregiver was absent and they were comfortable actually with the stranger. So the caregiver in a way gets rejected by the infant. And with the resistant insecure reaction, the infant gets an intense distress when the caregiver's gone and really uncomfortable with the stranger. But then when the caregiver returns into the room, they actually reject the caregiver on return. This could be because the caregiver is inconsistent in their behaviour towards the infant. So what was found, according to Bowlby and Ainsworth, that attachments with the primary caregiver develop during the first 18 months. That's quite a crucial time. And I know it's a lot of history, and it's really important to mention that. And in the Romanian adoptee study, there was a follow-up of children taken from deprived institutions in Romania, and they were adopted by family. And they found that about 20% had really severe
They struggled, didn't they? Like, they were not able to form an attachment with the new caregiver, wasn't it? Or something like that.
So they had severe sort of issues, especially at the age of 6. If you're about 6 years old, depending on the exposure of the deprived environment you had, and that was strongly associated with severe disinhibited behaviour. So obviously, I mean, that will make sense if you're not having a strong base of an attachment with your primary caregiver and you're neglected and you're thrown into institution to institution, the way you attach further on in with people is going to change as well. And actually, I might just quickly add a case, which I wasn't going to do.
That would be great. I always find examples help to understand what you're saying a bit better.
So I had a patient who really, really intelligent, smart woman, actually. And she had a very sad story. And obviously I'm changing it for confidentiality. But she was thrown into different institutions almost every year from the age of about 3.
Oh, my goodness.
Yeah, until she was about 14. And that has, you can imagine the impact that's had on her future relationships. And she's not in a relationship and she's nearly 60.
How could you trust anyone?
That's the thing. So she has no trust, and she has no trust in the staff. It took a long time for her to trust me, and luckily she really did. But you can imagine how that would impact you and your mental health. And even things like that does increase your chance of having mental health, because if you think about it, you're not having a stable ground and a basis to form an attachment or to build your autonomy and your development cognitively, physically, mentally. That's really going to impact you and how you then have attachments later on with an individual man or woman. So it can really disturb your peace of mind. I also wanted to quickly add about Erik Erikson. I love just saying his name. It always rings off really well on the tongue. So this is something we really have to learn for psychiatry exams about Erik Erikson. So this is quite in depth, but I was going to end on this because it's so intense, the different stages. But that's what attachment is. It's not a simple, it's a link between a caregiver and infant. You really have to actually hone down a different step. So I thought I would talk about this, and I think it'll be more interesting to any psychologists listening as well. So his work was based on Freud, which again, I'll talk about in a different episode. But so his stages of development are based on how children socialize and how it affects their sense of sort of self creating. And he created 8 stages of psychosocial development, which we call. And these stages I'll talk about now. So 1, you have, so these stages, if you imagine it from sort of the birth of the infant all the way to kind of your death. So it follows like a timeline. So if you think about it, how we talk about when we were growing up, you say 1 year old, 2 years old, 3 years old, 50, whatever, middle age. So he did that similar thing, but he put it in categories. So certain ages in a certain slot, and he did it in order. So we'll start from the beginning. So the first one is infancy. And here he highlighted, this is when you kind of establish trust and mistrust. So here the infant needs a lot of attention to develop a sense of trust with their caregiver for the attachment. Then we move on to the second stage, and that's early childhood. And he here says this is autonomy versus shame and doubt. So here, toddlers begin their independence and develop sort of their personalities in a way, and where they might find kind of who they are, so how they react to certain situations, their tantrums, their defenses. Then the third stage is preschool. So here it's initiative versus guilt. The children here learn sort of the social roles and the normal roles. Then we move on to the fourth stage, which is the school age. So here he highlights this is industry versus inferiority. So the child builds important relationships with peers. They tend to feel academic pressure here, and mental issues at this point may arise or become sort of observant here. Then we move on to the fifth stage, which is adolescence. And here, this is where you build identity versus role confusion. So you begin to experiment, obviously, with who you are, your role, who you are in autonomy. And this helps, in this stage, put together your identity of who you are. The sixth stage is young adulthood. And this is when we look at intimacy versus isolation. So this is about 18 to 40 years old. And here is the sort of stage where you can build satisfactory relationships. You can build that sense of safety and commitment. Then we move on to the seventh stage, which is middle adulthood. So that's about 40 to 65 years old. And here, this is where you sort of establish your career or your family, for example. And the last stage, he says it's late adulthood, and that's 65 above, essentially. And this is ego integrity versus despair. So here you might have reduced productivity. Successful navigation at the stage will protect the individual from feeling depressed. And what I mean is, you can either, because you're not being so productive, you might go into despair, or the opposite. So and when I say navigation, I mean move your path into doing something that will protect you from feeling depressed, for example, and instead get that wisdom. So taking on a different task or a different strategy to keep yourself busy and your mind active as well, so you don't go into despair or go into depression. And then I thought here I'll just talk about, because you might hear it sometimes if anyone works in CAMS or your child or someone you know, reactive attachment disorders.
I haven't heard of that one.
So here, this disorder occurring in infants and young children is characterized by persistent abnormalities in the child's pattern of social relationship, which are associated with emotional disturbance and reactive to changes in the environment circumstances, e.g. going to different institutions growing up. So this is normally diagnosed before the age of 5 and may manifest as either inhibited or disinhibited. It's more common in poverty-stricken individuals and quite deprived sort of social environments of infants and children. Causes? Well, it can occur as a direct result of severe neglect from your parental caregiver figure, abuse, serious mishandling, and there are other factors as well. So being young, isolated, inexperienced, or having a depressed caregiver, parental figure. So some features of this category of individuals is having fearfulness, hypervigilance that do not respond to comforting, poor social interaction with peers is quite typical. You might be really aggressive towards yourself and others as well. And you might have gross failure in some cases. And the last thing I wanted to touch on was a disinhibited attachment disorder.
That's another one I haven't heard of.
So here, sorry, it's very, very educational material today, but here what that is disinhibited attachment disorder of childhood. It's characterized by a particular pattern of abnormal social functioning that arises during the first 5 years of life. During the early stages, it's usually manifested by being very clingy as an infant and diffuse non-selective focus attachment behavior as well. So really, really clingy and sort of attaching to anybody really, not just the caregiver. Usually by the age of 4, diffuse attachment remains, but clinging tends to be replaced by attention seeking and incredibly friendly behaviour that's not really appropriate for an infant or child. During middle or later adulthood, this behaviour can persist and depends on the circumstances and can be associated with emotional and behavioural disturbance. So that's kind of a nutshell on sort of this half of the attachment, and that's all the theories that we learn about attachment, and something that all psychologists use, especially with their meeting parent and their child, and that's different theories that we have to learn as well. So is there any questions about that? I know it's quite overloaded of material.
Yep, that was quite a lot, and I'm sat here trying to digest all
it,
of what you just said.
It's hard to digest it. Yeah.
Oh, that's a lot.
But you have to remember, this is something that we have in an entire exam, and so obviously that's a lot of information just for like 20 minutes. Yeah. It's a lot. But in another episode, I'll talk about Freud and sort of his developmental theories as well with attachment. So, I mean, it's really funny because before I started psychiatry, I didn't think there were all these different ideas to attachment. I thought, because I was quite heavy into obstetrics and gynecology, so I thought attachment was simply that innate bond that a baby has in a way with their mother when they, for instance, touch their breast when they're born, and that you get that instant link and attachment. But I didn't. So when I entered psychiatry and I found out about all these different things with attachment, I didn't realise it was a whole exam's worth of information, not a sentence. But there was just so much to it. And so many different theories from incredible big names as well. Freud, Ainsworth, Bowlby, the list goes on. And it's something that's still researched and studied today because there's such interest and curiosity as to how a child's developed and their attachment and how significant it is in their life. And obviously it is significant. I'm very lucky. I had a very secure attachment with my mother. So, she's a very, very kind caregiver. So I think because of that, it's helped me. But I know, many around me that haven't had that. And it can cause a lot of problems and can really affect you.
Yeah, I don't think I necessarily had a secure attachment with a caregiver when I was growing up. So I wonder if that also impacts some of the things that I have.
Have you found that you have any trust issues with individuals?
Oh, yeah.
You do?
I don't trust anyone.
Yeah.
Including Lawrence, and I think that frustrates him quite a lot, which I can understand why it would frustrate him. But from my perspective, what it is that people inevitably hurt me, and so I'm going to stop that hurt by not trusting them, because then I can't be disappointed. And like some of the things, yourself. Yeah, exactly. And some of the things you were saying, like with the child under 5 starting to exhibit the violent behaviour to others and themselves and things. I'm sat here going, yeah, I think unfortunately that might have been me, because I was asked to leave play school because I was being violent to other children. So I'm like, that doesn't sound particularly good.
Do you remember that time?
No, I don't.
You don't remember it?
I only know this from my mum going, oh, you were such a difficult child. We had to move you from one play school to another because you were violent. And I shouldn't find it funny, but I don't remember it. I don't remember doing it. I don't remember what was going on at the time.
No, of course,
I must have been highly distressed.
No, I think that's really common. When I've worked in CAMS, I've seen really, and it's really sad actually, because I do sometimes really simplify it. And I think if you just had really lovely parents, actually, in quoted brackets, your life would be completely different. I just think it's sometimes, especially when it comes to mental health, people don't realise the power of the social circumstances you have. And it's really sad, because I've had really repetitive, and you go in these cycles. So I've had so many adult patients who unfortunately are just not well, and they just would not be suitable parents, and they've had children. And unfortunately, because of that sort of broken up parent link and attachment they've had and inconsistency, then their children unfortunately come into services, and then I see them. And the cycle is really hard to break if it's not stopped. And unfortunately, it will go on to your children, and you're most likely to have children who will have unfortunate issues, because if you as a parent have them as well, and you're not behaving as you should as a parent should be. So I always say, I think, and this doesn't just go with mental health, thing with anything, if you know you're not going to be a good parent, please don't have a child. I think it's the most awful thing, because then you're subjecting your child to this life that they never asked for, and there's no autonomy for them. And they're brought into a world where unfortunately the circumstances aren't in their favour, and they've got to have a very strong temperament in order to get through these life circumstances, because obviously it will affect you. It reminds me of that play as well, Blood Brothers. Have you ever seen it? Yeah,
I haven't seen it, but I've heard about it.
So without giving away obviously what happened, so it's twin brothers, and essentially I can't remember the reason, but they're separated from birth, and one falls into a life of luxury and prestige and has a good job and has everything kind of, tick, 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 and obviously thrives in life. And then the other brother is put in sort of a deprivation, everything that he should have as a person doesn't get, and obviously that affects his circumstances and who he is. So obviously I won't go into what happens, but you can imagine that's obvious, because if you're brought into a world where you're not getting the basic care, the love, the food, clothing, home, attention, safe development with your caregiver, it's going to be very difficult for you to not have emotional problems, I think, later on, and with others, and with other children as well.
Yeah.
Can I just ask, did you ever have sort of going over to school friends' houses or birthday parties, or do you not remember?
When I was that young, I probably can. I mean, the main thing for me was that because I was suffering with gluten intolerance. Whenever I went anywhere, I'd have to take my own food and kind of, in some ways, kind of be a bit isolated from everyone.
Okay.
So
that's
it
quite
was a bit tricky.
Yeah,
because I think those memories overtake everything else.
Yeah.
But I don't remember when I was at the second preschool being as violent, and I don't know why that is. I don't know if
Do you remember how you were then in secondary school, so from 11 years onwards?
Yeah.
Did you have any difficulties like forming friendship? I hope you don't mind me asking.
Yeah,
you did,
yeah. And I have issues now recognising what my therapist says are my needs. So we talk about this quite a lot. So I think I grew up in an emotional depriving environment, so my emotions were missed. And she's like, well, what is it that you need? And I'm like, I have no idea, not a clue. And she's like, is it a hug? Is it just reassurance? Is it something else? I'm like, I don't know. And I'm like, how can I tell you what I need when I didn't get it in the first place? So, yeah, there wasn't that ability for my parents to be in tune with what I was feeling and what I needed at the time.
Well, that's the thing. To be a caregiver, you've got to be sensitive to what your child needs. That's completely right. You've got to pick up on their emotions. And actually, there's this, I remember I was talking to an analyst last week, and what did she say? It was really poignant. So she said, being a parent is having the ability to deal with your child's need to cause distress and not dealing with their own sort of inner hatred. So what she meant by that was, if you imagine a child forms, we always talk about really the mother. If I just concentrate about the mother, I mean, obviously you can be a father and that's fine. It's just easier to imagine the scenario. So, a child is breastfed by the mother and is sort of coddled by her, for example, and then sort of that attachment in a way is savagely ripped apart because the child is forced into sort of becoming separated from that individual and not sort of the same being in a way, symbiosis in a way. And because of that, dealing with that frustration, that inner sort of anger and rage and tantrum, and just being able to contain that is the role of the parent in a way. And the child's distress at not being that close with the mother or feeding off her breast or seeing the mother with father figure, for instance, and having that bond and knowing that you're not sort of part of her, crosses into the sort of sexuality and things like that. But just that containing that with a child and being able to deal with their distress. So, for instance, dealing with a child crying in a safe manner and secure manner, and understanding obviously that they're not in control of that and there's no filters in a way, and that ego strength, and being able to contain that. So I went off on a tangent a bit there. I can't remember why I did that. It's the fact of picking up on, I mean, we'll talk about sort of analyst sessions, I think, another time, and we'll really delve into analysing things. I think that would be really interesting, because then I can talk about the sexuality side and Freud's oral anal stages and things like that. But just dealing, I think, objectively, just generally, not talking in analyst terms, that, dealing with your child and knowing what their needs are, simple from feed to crying to comfort, dealing with all those aspects will obviously form their development of emotionally dealing with their links further on in life, basically, is what I'm trying to say. So I think when you say you have issues with trust, I'm not surprised, because if you've had a
to be fair,
I mean, surprising. As in, I don't mean in that way, but in the fact of, if you haven't had a parental figure that has been consistent with you and caring to your needs, then that obviously would have a repercussion, I think, if that makes sense.
Exactly. And in some ways, they would constantly hurt me by kind of dismissing me. And so I probably want to stop that now, is that I'm afraid of being dismissed.
Do you still feel like that?
Oh, yeah.
You still feel like that?
Yeah. So I constantly feel like I'm not good enough. I'm a failure. I'm just not good enough at anything.
And if you don't mind asking, was that both your parents or was it one?
I think it's primarily my dad, but I do think my mum was in some ways quite emotionally absent.
Okay.
So because she didn't necessarily pick up on it, and then Dad would be like, anger, the only thing he would express is anger. And if I got angry or I got sad, it would just be almost a dismissal. It's like, stop being such a drama queen, or you don't need to do that kind of thing. And I can understand that maybe he was just trying to help in the situation, but it didn't help. It just made me not then understand my emotions and listen to them.
It seems like here with your dad, it's similar to what you're saying. So he wasn't able to tolerate sort of, you know, the frustration of dealing with whatever's being present in the child and not being distressed himself in a way. But
well, yeah, I was quite sick baby to begin with, which probably didn't help matters. And so they were like, you were so sicky, you were always sick and crying. And I was like, well, I guess that might be because I was in pain. I don't know. I was too little to understand. But he would tell me times when he literally was just sat with me and I'd be in like the baby bouncer or whatever it was at the time. And the only way that he could get me to sleep was to literally violently rock the cradle. Like, so I'd be bouncing, because that was the only way, I'm guessing, that relieved the pain and that I could then get to sleep. But obviously that's going to take its toll on them because they weren't able to help me.
No, of course, like, circumstances are different for everybody. And it's not me being patronising, like, you've got to be like this as a parent. It's obviously circumstantial, and things aren't so easy and black and white like that. And even if you have all the circumstances, it's also, you know, it's challenging having a child anyway. And it brings, like, I think it does bring almost the best and worst in you as an individual, because you are dealing, I mean, it's traumatic to have a child anyway. It's a traumatic event, and dealing with that after, you know, it's a life commitment as well. And obviously, very, very stressful as well. Puts a lot of distress on people.
I do think that also that because I was a sickly baby, that I may have been a little bit resented by that fact as well.
Yeah, possibly.
Which is, again, fair enough. It's not like I was probably the easiest child to bring up, but you kind of go, well, I didn't ask to be here. I mean, that's exactly it. I mean, having a baby's hard, but especially if they're unwell, very difficult. So I have a relative, and I just admire him so much. I don't know how he does it, because I don't know how I would cope. So he has 4 children, which is, I think, amazing in itself. But one of the children actually has a severe learning disability, so is in a wheelchair and has to be cared for 24 hours. So having a child that unwell and that needs so much sort of support and attention, as well as his 2 other children out of the other 3, they're unwell anyway, but not severe. But I don't know how he does it. I genuinely don't know how he does it, because I always think, I don't know how I would cope with one child being unwell, let alone you know, several. Yeah, exactly. And especially one to that degree. And he completely thrives off it, in the sense, not in a perverted way, in the sense of this man, whether he can just contain this stress so incredibly well that it's not projected elsewhere, but is able to digest that. He is a terrific father, and I don't know how he does it. He's made it such a supportive, optimistic household that you don't even notice that he's got other children that are unwell, because they're thriving so well. And, you know, one of his kids is hopefully going to medical school. So you imagine how safe and supported he is as a father, as well as obviously working and just being a human being in himself. It's absolutely incredible. And his child, who is disabled, is now officially actually in age an adult, and he still caters for him and supports him and cleans him and still takes him onto family functions. And I've never seen anything but a smile on his face, and it's absolutely incredible what some people can do in these situations. So, you know, sometimes, you know, people are able to come out stronger in these circumstances, but sometimes it brings the worst in others. But it depends obviously on your temperament, really. It's interesting.
Well, I mean, that was attachment in a nutshell. I hope it wasn't too overwhelming. But if anyone has any questions or wants any further clarification, that's great. Let us know. And I'll obviously be talking about Freud and attachment and developmental in another podcast.
Brilliant. Well, thank you so much. It was, as I said, completely fascinating, and I'm quite looking forward to the next one. So in the meantime, remember, it's okay not to be okay. And if you're not okay, talk. Thanks for listening to this episode of the Mental Health Book Club podcast. If you need additional help with your mental health, please contact the Samaritans on 116-123, which is a 24-hour helpline. And if you need additional information about mental health issues, please visit Mind at mind.org.uk. Our next episode will be a review of August's edition of Happiful Magazine. Our next book will be Love and Remission by Annie Belasco. If you'd like to find out more about the MHBC podcast, please visit our website, mentalhealthbookclub.com. We really hope that you enjoy this podcast, and we would like to hear what you think. Please head over to Twitter and follow us at MHBC_podcast, or head over to Facebook and follow our Facebook page, which is Mental Health Book Club. If you would like to show your support further, please share us with your family and friends, and leave us a 5-star review wherever you get your podcasts. You can now support the Mental Health Book Club podcast on Patreon by going to patreon.com/MHBC. For as little as $2 a month, you will be able to get early access to our episodes. You'll be able to get our full episodes, so usually I split them into 30-minute episodes. You can get all of the episode in one go, and you will also be eligible for free prize draws and other giveaways as we go through. If you choose to support us on the silver level or gold level, you will now get a Mental Health Book Club podcast tote bag which says it's okay not to be okay. And when we meet our target of $200 per month, we will be then giving $50 to Mind, the mental health charity. We would absolutely love to be able to get to this position because we want to be able to give back to the mental health community as much as you guys help us out.